we want to be making an impact, and we want to help patients who do not have services. We feel like the mild population is being served by many companies, and yet no one is serving the people with severe illnesses.
And now, from San Francisco and the UCSF Rosenman Institute, the Health Technology Podcast with your host, Christine Winoto.
Mental health is a huge topic right now, but often conversations about mental health are mostly about anxiety and depression, not as much about serious illnesses. That's why our guest today, Thomas Tsang, is doing what he does. Thomas is the CEO and co-founder of Valera Health, a telemedicine company helping patients with severe mental illnesses as well as mild ones. Thomas is also a former senior healthcare advisor to the governor of Hawaii and has directed national medical programs. And as someone who came from an unprivileged background, it is important to Thomas that people have access to essential medical services. Here's our conversation. Well, thank you, Thomas, for joining me this morning.
Thank you for having me, Christine.
And so I thought I've been watching the journey that you've been doing with Valera Health. It's been amazing. And I look at your experience, it's almost like you designed it all along to start Valera. But can you share with us about your journey, not just your career journey, but also what are your personal experience that shape who you are today and give you the passion to start Valera Health?
Thank you, Christine. Well, I have not purposely hidden this, but not a whole lot of people have asked me actually. But I love to share this piece of me that not a whole lot of people know. So I came to this country from Hong Kong in 1974 with 4 other siblings. And one night in Hong Kong, my mom was taking care of 5 kids. We were living essentially in a shack with no running water, very little electricity in the outer hills in Hong Kong. Remember, this is 1970s, so it wasn't as modernized as now. And in the middle of the night, some man appeared, and it turned out to be my father. And I did not know who my father was until I was 5 years old. He was in the United States sending money to my mom to take care of us. And he came back to bring us over to the US. And he finally got his green card and his immigration papers and his sponsorship. So we came in 1974, and then soon after that, my little sister was born, and there were 8 of us in a 3-bedroom apartment in Brooklyn. And I didn't know a single word of English until 4th grade. And neither of my parents are literate in Chinese. They never went to school in China. So they're completely uneducated and illiterate in both English and Chinese. And so that experience has really helped me understand what's it like not to have resources and not to have health insurance. We didn't have health insurance. I didn't have health insurance until I was 18 years old. Mm. And that experience, when we were sick, we basically went to the doctor in Chinatown and we paid cash for the visits. And we had to also negotiate with the doctor how much we could afford and the antibiotics or whatever medicines he gave to us also. So that absolutely kind of gave me insight on what immigrants and also lots of communities and residents and Americans who are underinsured and don't have access to healthcare, what it feels like the first 18 years of my life.
Wow, it's interesting because, when I hear stories before about the same experience that you had, but it was referred to something, this is what happened in India. And majority of people in America probably did not think that you have to negotiate with your medical doctor about what medication that you should get.
Yeah. I mean, not a whole lot of people kind of know this about me. And I think some people just make an assumption that just because you have an MD behind your name and that you're running a startup, that you came from a privileged background or came from a set of parents who had PhDs or college degrees, and that's really far from reality of what I grew up with. And so, it's always having that humble perspective of the things that are the most basic and fundamental in your life, and not having them, and what are the downstream consequences, and seeing your not just your family but your friends and family, and the people around you in your community go through such hardship just to get the basic healthcare needs taken care of, and that kind of led to finishing high school, but being accepted by a 7-year BSMD program that would combine college and med school. But that program was basically free and was open to interurban kids so that they could train doctors to go back to the community. And that was the program that I got accepted to, and that was the program that I finished. And I think really along the journey was this kind of environment that nurtured this interest in public health and access to care.
And so you had that personal experience, probably as many immigrant kids whose parents don't speak English, and you have to navigate along for them and maybe for your younger siblings as well. And then being in a place, studying in a place that's the focus in a public health. What are the things that you learn from it that become your core, almost like your compass along the way? Of course, it changed. You add more things, but then I'm sure from that experience, you have something that stay with you.
I wanted to impact the community and be useful and have a mission for the community, and I think that carried over from my early days growing up in Chinatown, and I finished residency in the Bronx in internal medicine, but I ended up, my first job was going back to Chinatown and running the residency program for internal medicine residents, working side by side in Chinatown, and then being recruited by Charles V. Wang Community Health Center, which is a federally qualified health center serving the Asian immigrant population. And that was another, 5 years. And that's led to this stint in Congress in the Ways and Means Committee working on the Affordable Care Act. So really the trajectory all along has been focused on health disparities, community health, public health, and access to care issues.
And so what did that experience that you brought along when you're being part of the Means, and is that the word, Means and Subcommittee on the U.S. Health, part of the Congress?
That was a little bit of luck. That was being at the right time at the right place. And when I didn't know, when I applied to the program, which is sponsored by the RWJ Foundation and the Institute of Medicine, I didn't know who was going to win the presidency, whether it was John McCain or Barack Obama. I applied blindly, and we didn't know, of course, until late November, and until November after Election Day. But we were accepted. I was accepted into the program by September or October, and I committed to the program. And I think it was just chance and luck that Obama won, and the two biggest pieces of legislation impacting healthcare was the first year of his term. It was the stimulus package.
Mm-hmm.
And then afterwards, it was the Affordable Care Act. And the stimulus package had the monies directed towards helping hospitals and doctors implement and adopting electronic health records. And then the Affordable Care Act. So as a congressional staffer, I was able to be part of the process of developing the ACA. And that was such an honor and a privilege to be part of that process.
And probably because you're part of that process, I remember when they passed the bill, there's like thousands of pages. So it's hard for any human being to understand the whole thing. But maybe because you're part of the process, you got to know a lot of the ins and the outs and what's possible and what was not quite possible yet.
The House Ways and Means side was on the House side. And there was a team of folks working together from all the four major committees. It was the Ways and Means side, Energy and Commerce, House Finance, and Senate Health. But it was a very, it was a process where things were dissected and discussed throughout the entire, the two houses, and input from stakeholders were brought in. So it was certainly an eye opener. I was one of the few doctors who was a staff member, so that also helped give some input in the process.
Yeah, it's interesting because I felt like when you're the doctor, as you said, it's not that many doctors who are part of the team. And I guess you must have the interest to let's try something new to apply for that role.
The program is still in existence. It's one of the, I think, pride and joy of the RWJ Foundation and its human capital portfolio, taking mid-career individuals and giving them an opportunity to work in Congress and help give input to legislation and policy making, and groom them to be the healthcare leader for the next generation. And the program is still running, and it's a bipartisan program, and I think it's a huge opportunity for mid-career individuals to go through that who are interested in policy work. Yeah.
And so from that, you had the opportunity to work at Merck, which is a large company, before you started this whole Valera Health. How do you jump from being in a big corporation? Because oftentimes when you're in a big corporation, it's kind of nice, cushy job. You don't really feel the need to go to startup.
I think in hindsight, an optimal career trajectory would be 1/3 public service, 1/3 private sector, and then 1/3 community service. And I thought, I've never been in the private sector whatsoever. My early work at Chinatown Health Clinic and running the residency, it's kind of considered like a nonprofit work. And then my government work was exactly that, civil service and government work. And so I was really intrigued at the Merck opportunity to be in a global position, to work on innovations because of the things I learned in Congress, and bringing the knowledge of health technology into the kind of like the frontier of pharmaceutical work. And So that was quite an experience. I learned a lot. But ultimately, I wanted to move faster and wanted to do my own thing. It was just my nature. And so that's when I decided to launch Valera.
So have you had this idea all along? Have you seen the needs all along? Or you just say that this is an area that I'm always interested and this is where I want to pursue?
Absolutely not. I mean, it's something, I think most of my life, it's really things pop up through serendipity and through chance. And I think it's a convergence of chance and luck and timing. I did not plot this or think of this. It was just a chance meeting with my co-founder, Ofer Sharon, who was part of Merck Israel. And then we started talking about technology and what technology can do for healthcare, and so that's when we decided that maybe there's an opportunity to bring technology into mental health.
Mm-hmm. Maybe this is a good segue for you to tell us, what is Valera Health? What does it do? How is it different from any other technology out there to serve mental health?
So we're a virtual mental health service providing comprehensive services to a wide range of conditions, running from mild depression, anxiety, all the way through severe illnesses like schizophrenia and bipolar disorders. We also provide service to a broad range, starting in some markets, starting at the age of 6, all the way up to above 90. And many of our patients have been with us for longer than 14 months. So we act much more like a longitudinal private practice model. And the differentiators is the fact that we actually see people with severe schizophrenia and bipolar disorder. Very, very few other companies do that. Our population right now is over 50% of them come from BIPOC communities. And many of them have government insurance. So we also accept 99% of our visits right now have patients using the healthcare benefits and health plans. And many of the companies out there do not accept health plans.
This podcast is sponsored by Brown Rudnick's Global Life Sciences Group, a team of legal professionals that help life science companies, lenders, and investors around the world turn good science into good business. Learn more at brownrudnick.com. This podcast is also sponsored by Canon Quality Group. Canon Quality Group has been helping medtech startups set up quality management systems for over 10 years. If you're unsure when to get started with quality management in your startup, turn to the experts at canonqualitygroup.com.
So, like you said, many of other company or technology are serving more the mild mental illness, but not the severely mental illness patient population. Why go there? Probably it's not an easy patient population to serve to begin with. That's why many people probably avoid it.
Right. Absolutely. And I think this is the connection between my past personal experiences and to our mission is we want to be making an impact, and we want to help patients who do not have services. We feel like the mild population is being served by many companies, and yet no one is serving the people with severe illnesses. And we want to make a difference. It's as simple as that. We want to be there to help these people. And we think these patients are not getting the help that they need, especially during the pandemic. We launched our service July 2020, right in the middle of the pandemic. And we've analyzed our data. And in New York, we're serving patients. A majority of patients live in mental health shortage areas as defined by the government. And we're able to reach these people who otherwise would not get care anyone else.
And so educate me a little bit. When I think about the mental illness is oftentimes you can go to virtual, help you with some CBT therapy and maybe meditation. But when it comes to schizophrenia and bipolar, it seems hard to imagine that kind of illness can be treated through virtually. It seems hard to imagine for me.
Right. Well, it is, and we're doing it, and we're doing it with great outcomes and great adherence. Patients with severe disease need medications. They need to find the right combination of medications. They also need therapy, and they need potentially social services. But they need stability. They need an infrastructure that will give them access to care. And so almost 30% of our visits are of patients with an SMI condition.
Mm-hmm. So walk me through, if I have the SMI condition, I joined the Valera platform, and then what happened? What's the journey like for me?
So you'll see most likely a medication prescriber, either a nurse practitioner or a psychiatrist. You'll get assigned a case manager who we have as a full-time employee. And most likely you'll also get a therapist. So it's a multidisciplinary approach. And you'll be seen either on a monthly basis or a weekly basis, depending on whether it's therapy versus medication. The case manager will touch base with you to make sure everything is okay. Make sure that you're also going to get some blood tests. And most of the stuff can be done through a virtual model. And
I think that so all your case manager, you said, that's employee of Valera Health. So I assume the other healthcare providers also part of your larger employee
network, right? Okay. Right. They're also employees. Most of them are employees. Okay.
And as a payer side, sometimes when something new, like, how could you help patient with SMI? And yet they do. I mean, they pay. You take health insurance from them. So what evidence do you have to show them?
We present the health plans, our health outcomes. I think we're one of the few companies that use a measurement approach. And we use the technology to really measure how patients feel. We also use national quality metrics and measure out providers and make sure that they're, abiding by the highest standards. And we present the data back to the health plans.
Mm-hmm. And so I'm just trying to, I know we are coming short on time. I just want to make sure I ask the question. So all this, because you said that you launched in July 2020 during the pandemic. It's good timing and bad timing to start a company or to launch a technology. What are the lessons learned that throughout this journey that you have to redo it, what would you do it differently? Or things that you feel like this is going to work really well and this is what I'm going to keep on doing?
Yeah. As a entrepreneur, you need to have tenacity and you need to really have strong faith. You're going to have a lot of people who say no in the beginning, and you just have to keep on going at it. We grew before July of 2020, we were less than 15 people. And now on the corporate side, we've almost 7x that.
Wow.
So in a short 20 months, we grew really, really rapidly. And so you need to find the right people and the right talent to surround yourself and bring in skill sets that you don't necessarily have. And you can't do this all alone, and you have to do it as a team.
And I assume when you started Valera Health, many of your patient population you mentioned are in New York area. Is it? I assume it's just expanded beyond New York.
We're in 7 states now. And we did that over the last 12 months.
And do you feel that every state is different?
It's slightly different. I mean, it's the same concerns by the populations, but some of the partnerships are different. Some of the health plans obviously are different. And so those drive some of the processes and how we kind of expand into the marketplace.
Mm-hmm. So last question. I must have imagined your parents never thought this is the journey that you would. And as being from Hong Kong, everybody's entrepreneur. They must feel like, hey, my kid is entrepreneurial.
Well, I would say, actually both my parents died in 2020, right during COVID. My dad was 95 and my mom was 85, and my dad, when it was kind of like the typical American immigrant story, he was working in a Chinese restaurant in the kitchen, and they really didn't understand why I didn't have a private practice, and since they said, why can't you just be like all the other doctors and just have your own private practice and see patients? Why are you dealing with all of this sort of other stuff? They didn't understand it, but I think it was they let me be my own individual, and I think that was good.
Yeah, well, that's good. I think sometimes some parents can be controlling in terms of what the kids can and cannot do. And I think I always felt if your parents let you chase whatever that's good for you, it's a blessing to have.
Yeah. And considering the background that they had, they gave me as much as they could.
Yeah, I think that's great. It's a great immigrant story.
Thank you.
Okay, well, great. Thank you so much for sharing your time.
Thank you, Christine, for having me. Thank you so much, and have a fantastic day.
Thank you for listening to another episode of the Health Technology Podcast. We want to thank our executive producer, Herminio Neto, and our podcast engineer, Andrew Rojek. If you enjoyed this podcast, be sure to subscribe and leave a review. The Health Technology Podcast is available on all major platforms.